You have your annual labs, your fasting glucose. Can you have normal numbers but still be insulin resistant?
So, yes, the short answer to that is absolutely. The mechanisms that cause impaired fasting glucose versus the mechanisms that cause impaired glucose tolerance are two different things. Impaired glucose tolerance is what we're usually talking about when we're talking about these crashes after eating certain types of foods, which is what a lot of people are experiencing during their workday versus impaired glucose tolerance is actually a problem with the way the liver is handling fasting. They both are risk factors for developing prediabetes and diabetes and type 2 diabetes specifically, but they're two different sides of the same coin. And you can absolutely not have impaired fasting glucose and have impaired glucose tolerance.
Okay. So then do you recommend people ask their physician for an A1C or fasting insulin?
You can 100% ask for an A1C. A1C also can be deceptively normal, though.
Okay.
So, what A1C is an average. It literally is the percentage of red blood cells that have sugar attached to the outside of them. And so, over the course of a red blood cell's life, it gets glycosylated, it gets sugars attached to the outside. And so, we are getting a sense of what your average is over the lifespan of your red blood cells, which is about 90 days. That means you can be having blood sugars that are spiking, but they're also dropping. So if you think about it, you can have an average that looks like this, and you can have an average that looks like this. And that like gentle rise and fall feels much better than the like spiky. And those two people can have the same A1C.